Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. I am so excited today to welcome my guest, Natasha Wilch. She is amazing, and I am thrilled for her to share her experience and goodness with us today. She has been a registered physical therapist since 2011. She attended the University of British Columbia, where she earned a bachelor's in health science and kinesiology, and then her master's in physical therapy. From day one, Natasha has worked in neurology. She focused her clinical practice on working with individuals with spinal cord injuries, stroke, Parkinson's, and other neurological diagnoses. She continued to develop her toolbox in postgraduate education in neurological rehab, functional neurology, chronic pain, dry needling, acupuncture, neurooptometry, and more. When Natasha relocated to Nanaimo, BC in 2014, she began to look for work in her new city, and it became clear that there was a massive care gap for the neurological population that she loved to treat. She decided to open her own clinic. Symphony Rehabilitation became official in May 2015. She's won Canada's Entrepreneur of the Year Award in 2017, the Physiotherapist Leadership Award of BC in 2020 for her leadership in the field, and received Vancouver Island's Top 20 Under 40 Business and Community Achievement Award for her work in the community. Today, Natasha's passion is evolving the conversation and culture of concussion around the world. She does that through her clinic, Symphony Brain Performance, her online mentorship program for clinicians, Concussion Nerds, and through speaking engagements. When she's not diving into more learning for herself, she's a forever student. You'll find her mentoring clinicians, working with clients, or spending time with her family. So thank you so much for being here, Natasha. I'm so excited to get to pick your brain today.
It is my pleasure to be here.
Yeah. So, and just so everybody knows, I signed up for Natasha's Concussion Nerds program and have been very impressed with the content and the education and the community that she's put together. I have no idea how you do all the things you do, Natasha, but I love it and I'm here for it and encourage you to keep on keeping on with it. So thank you. Yeah, I'm excited for this conversation. Well, I wanted to have a podcast episode focused on acute concussions so that when people come to me and are like, hey, my kid just had a concussion, what do? I can point them to this specific podcast episode. So thank you for being the one to help us understand this better. Okay. But before we jump into that, I would love for you to give us a quick summary of why it is that you're so passionate about helping people in the concussion space. And just, tell us what made you want to help with concussions specifically.
Yeah, I'll keep it short and sweet because we all know we can make really long stories, really especially me. So long story short, when I was 17, my dad had a brain injury. So a log rolled off the back of the truck on his head and he was in the hospital for a month. And when he came home, things were different, right? And this was, oh gosh, I don't do math. I'm 42. So however many years ago that was. And back then, 20 plus years ago, no one really rehabbed much if you looked good. B, no one explained to my mom what these changes could be, let alone the 17-year-old stubborn type A daughter. Really, that led to a series of events that had me moving out of my parents' home when I was 17 years old, having to grow up a little faster than I probably wanted to. And I'm really lucky in that my dad and I have been able to rebuild our relationship, and I really are in a beautiful place. But that is definitely a big piece of it. Except the funny part is I didn't even realize it. So when I opened Symphony, when I moved to Nanaimo, I worked with stroke and spinal cord a lot. And it's because my cousin became a quadriplegic and he was really my inspiration to become a physio and work in the spinal cord population. And I got referred a persistent concussion client. And because the OT that referred her to me was like, well, Natasha works with the brain and the nervous system, so let's send her a concussion because the concussion affects the brain. This was literally the logical thinking. And I looked at this person and I was like, I have no idea what to do. But I said to this patient, I was brutally honest with her. And I just said, I don't know what to do, but if you're willing to work with me, I'm willing to learn. And I always say, I think, thank God she didn't go anywhere. I think she didn't go anywhere because she had nowhere else to go. But I took my first course that weekend and I dove down the rabbit hole head first and I've never looked back. And so it was kind of her showing up in my practice, almost like re-sparking, because then I started to hear the stories and the narratives that we know affect so many of the individuals that are on a brain healing journey. And it's like it like lit a fire in me and reminded me of what I had went through and my family had gone through. And I was like, people shouldn't need to do that. And we've come a really long way, but we still have a really long way to go, I think, in terms of advocacy and awareness and education. And so that's kind of like the hub of like the initial spark. And now it's people like you who come through Nerds and the clients that I get to work with. Like now that's my fuel to keep going. But where it started, that's kind of the origin.
I love that. Thank you so much. And I really would love to bring you back on sometime and just dive into that story because that's a perspective that like I love sharing people's stories on here. And it's really, we haven't really gone into a child with a parent with a brain injury perspective. And I think that would be really helpful to have. So I wod love to bring you back sometime. So let's just jump right into recent concussions. So let's say that somebody listening to this has a loved one who got concussed within the last 24 hours. What would you tell them their first priorities should be?
So acute concussion is always that first 24 to 48 hours is rest, physical, cognitive rest. Gone are the days of having to wake someone up every 2 hours, but like, let's talk about that for a second. So if the concussion equals having to emerge, right? So any red flags, right? So worsening neck pain, dizziness, blurred vision, vomiting, increasing neck pain, increasing headaches, slurring of words, decreasing levels of consciousness. Those are all red flags that mean we go to emerge. So in the emergency department, emergency department, hospital, ER. I don't know what we call it in Canada versus the US.
I was going to say that's maybe a Canada phrase that I'm not familiar. I mean, I can figure it out, but just so we're clear, go to the emergency room.
I love when it like pops up and you're like, what? And I'm like, this is a country difference right here. Yeah. So in the emergency department, they will obviously clear you for more severe injury, right? And so I think it's important for people to recognize you go to the emergency department if you have those red flags because you're being cleared for a bleed, a fracture, or something more, I say more significant, but that would require immediate medical intervention as opposed to a concussion. But they'll hopefully they'll diagnose you with a concussion if that's what you have too.
So should people be checking and making sure like not letting someone sleep?
So no. So this is the piece. So if you go to the emergency department, they clear you, let your person sleep. But if you don't go to emergency because you're not seeing those red flags, right? And there's many people that don't go to the emergency department. Really, we want to keep an eye and keep them awake for the first, we say 4 to 6 hours. Because if a red flag is going to evolve, it's going to be typically in that window of time. Okay. So beyond that, you can let your person sleep. Sleep is such a powerful healing tool. We heal significantly in our sleep. So we don't want to continuously break that up. And as much as possible, we want to be getting people on a regular sleep routine in that acute phase to support the healing process. So we don't need to wake people up, but within those first, and we don't need to force someone to eat, right? I feel like it's like, you need to have breakfast. No, you need to eat. You need to keep them, stay hydrated. Stay hydrated. But if the person's not hungry, it's okay. Like in that first little bit too, like let them rest, truly physically, cognitively rest for the first 24 to 48 hours. But after that, now we have to work. And I think we need to recognize too is concussion rehab is work. It's not you just sit and wait and twiddle your thumbs and your brain gets better. It's no, this requires effort on your part and awareness. This is an active healing process. And so I always say too, get in to see a concussion clinician within your first week. The research shows us over and over and over and over again now that the sooner you can get to a concussion-specific clinic, ideally within the first 7 days, the faster your recovery outcomes are going to be. And that's because when you connect with someone like yourself or like myself, we can catch yellow flags, we can catch red flags, we can individually, specifically guide you in that early rehab journey, which involves exercise and then also going to be some specific exercise depending on how you present to the person. So rest for 24 to 48 hours, make an appointment within the first 7 days, but then also usually day 3, we're actually starting to bring in light aerobic exercise again.
Beautiful. Okay. I want to like dive into each of these a little bit. Okay. So with the rest phase, well, and actually before we even go to the rest phase, if somebody goes, let's say they've had a car accident and they get sent to the ER or their kid has, well, yeah, let's say that. And they go to the ER, tell us what testing or like what testing should typically happen. And if you're going to see a concussion specific clinician, what's going to be different between the ER versus a concussion?
It's going to be hugely different. And I say this because I present to ER docs and I'm literally on coming up, I'm presenting to a group of 280 trauma physicians coming up here too. So in Emerge, they're going to ask you questions, right? So they're going to do a basic neuroscan. They're going to look at your pupils. They're going to look at like some other things. They're going to do a basic neuroscan. They're going to ask you questions. And if you're presenting with the symptoms of concussion and your neuroscan is clear, they're going to most likely diagnose you with a concussion. Short, sweet, emerges fast, right? A concussion clinic. So there's 7 different profiles of concussion. So we don't have mild, moderate, severe concussion anymore. That doesn't exist as a grading system. Okay. Concussion is a mild traumatic brain injury. It falls in the MTBI category. But within concussion as a whole, we have 7 different profiles of concussion, which ultimately means I say like there's 7 main systems that within the brain that the concussion has been shown in the research to impact. And so our job when you come to a concussion specific clinic is to screen and assess for those 7 profiles to see how the concussion has specifically impacted you. Most people, when they think of concussion, especially if it's nothing they've experienced before, they think of headaches, they think of nausea and dizziness, and that they should be good in a few days, when in reality, we know that concussion can affect every impact of how you function. Your balance, yes, headaches, yes, dizziness, but your nervous system, your ability to sleep, like all the things. And so our job, which is what I preach so much about in Nerds and in my education sessions too, is as a clinician, we need to be screening for all 7 of those profiles. Depending on where you read, it's 5 to 7 because some research combines profiles. But we need to be screening for those 7 because if we're not, then we are missing something that could prolong someone's recovery.
Yes. Hey, thank you. That's really important and helpful, I think. And I do want to throw out there too, when people go into if they go into the ER, the testing that they'll do, like you said, they might do some like neurological testing, but they'll probably do an MRI and or a CT scan. And
if they're concerned
that there's
about something more significant. So it's always going to start with the bedside exam and like the neurotest. And if their neuroscreen or the injury or the mechanism is significant enough, then typically they'll go to imaging, whether it be CT, MRI, X-ray. In Canada, it's usually a CT and then an X-ray and a CT. But okay.
Well, and I just want people to know who are listening that those don't diagnose concussion. So if you got those tests done in the hospital, that does not mean that you're clear and you don't have a concussion. If they say you don't have a bleed or something, so it's important for people to know that, because I've heard people say, "Well, I got testing done and I don't have a concussion," but like that's
a huge point, right? Like huge point. And if they're doing those tests, they're ruling out something more significant that would require immediate trauma intervention, or that would require an intervention of some point at that point. So it's exactly that's it. And it's like down the road too. It's like there isn't imaging that is readily available in our healthcare worlds to diagnose concussion. Concussion right now is still a clinical diagnosis, and we base it on it's ultimately based on symptoms. And then the things that obviously we objectively assess things in the clinic to know what to treat, to then get to the root of why someone's having symptoms.
Yes. Beautifully said. Thank you. So what would you say for somebody who's going in to see their clinician, like at a concussion clinic or just a doctor or whatever, like if they're going to see somebody, how will they know if it's a quality provider? Like what kinds of things should their clinician be asking them or looking for?
Yeah. It's funny. I literally just filmed a reel yesterday that was like 3 red flags for a clinician to find a new clinician.
Love it. Tell us what those are.
So the big thing is, just from a interaction standpoint, is ensuring that you feel validated and that you're actually being listened to. That's key. That's number one. Number two, if it's a timeout for a second, it's not a physician's job, so a general practitioner's job to treat your concussion. There is no way they know all the components to assess and treat a concussion appropriately. Your general practitioner's job is to help facilitate referrals and be like a hub point for people to come together. And I think it's really important people know that. As long as you are being heard and supported to help you go on the right path, that's your general practitioner's job. In terms of clinicians like yourself and like myself, to me, it's I'm really biased in the sense that if you're not looking at the 7 profiles, then you need a new clinician. Now, granted, that doesn't mean someone's going to do something all in one day. So I'm really key on educating. So if it's a clinician that is shaming you, so I'm going to go really broad here, telling you that certain things shouldn't be being done because they're bad and they're going to prolong recovery, but that's not making sense to you and they can't provide a logical reason why. AKA, I just literally spoke with someone who a clinician told them that they shouldn't seek mental health support and they shouldn't journal.
What?
Because that's going to prolong their recovery.
Okay.
Excuse me?
Right.
Right. So if you go to a clinic and they pop heat on your neck and walk away and then tell you and like do a little bit of manual and they tell you that's it. Right. So my big thing is actually, and I had this beautiful example with a client who explained what they were doing. This is a really roundabout tangenty answer. Sorry, guys. I'll try and summarize this after. What they were doing for neck therapy with their physio. Their physio is great, by the way, like great physio. And they outlined what they were doing. And I looked at the client and I said, that is a fantastic example of siloed care. I said, because while they're doing a fantastic job at treating the neck, by the sounds of it, the next step is that we have to integrate the neck with everything else. Mm-hmm. And if we don't help that process, sometimes it doesn't work well. And so really when you're looking at your clinicians, you're looking at someone who, if you ask a question about concussion, they can answer it. They educate you appropriately. And so for me, educating about the 7 profiles is something I always do because it's really hard for a client sometimes to understand how they're irritable or emotional or crying at the pin of a hat and their neck pain and then the fact that they're a little bit dizzy are all interrelated. Mm-hmm. And so we need to be able to educate appropriately. We need to truly be screening for the 7 profiles and we need to be guiding in active rehabilitation. Now, it is hard for a client to recognize if those things are being done, I think. And so the big things would be like, you're being told to wait, you're not being given anything, or you're like not being explained like what has been actually impacted and guided on a treatment plan. And yeah, that's kind of the piece of it. What I say to clients is you should feel like you should understand what's happening. You should understand what is been impacted and what the plan is to move forward. If you ask your clinician what the plan is that you're working on and they can't answer you, that's a big problem. And so I always just say, like, don't be afraid to ask questions. And your therapist better be able to answer them appropriately. And if they can't, they either need to be vulnerable and honest and say, you know what, I don't, because I've done it. Like, I don't know the answer to that question. But let me see if I can figure it out for you. Or they can answer it. So that was a really roundabout answer.
No, I appreciate it. I think the like real life stories is helpful too. Like what people are actually like things that you've heard people say they've experienced with it. So I think that is helpful. And I think it might be helpful just if you want to, we don't need to like go into all of them, but can you at least like name what those 7 profiles are so people have a feel?
Yeah, for sure. So one is the autonomic or physiologic profile, which usually shows up and gets tested in the beginning for most providers as like an exercise intolerance test. So, which means as you start to get your heart rate up, you get symptoms. So in most clinics, that gets tested on like a bike or a treadmill. That's only one way to test that system, but that's the most common one in acute stages. Then we have what's called your vestibular phenotype, or profile and your ocular motor profile. In some places, they will combine them and call them your vestibular ocular profile. So this affects your vestibular system and your visual system. Really common symptoms for these two profiles are obviously increased symptoms with using your eyes. So reading, screens, having to look back and forth between things or up and down between things, dizziness, lightheadedness, that sort of thing. Cervical, so your neck, right? When you look at the mechanism of concussion, you need significant amounts of force to actually induce a concussion, and you need way less than that to get whiplash. And so the neck needs to be looked at as well. Cognition is a biggie, and many people have cognitive challenges after concussion. And then we have, this is where I'm like, when I have to list them, I always forget what they are. Affective. So mood, anxiety, depression. But you know what? I was reading a study lately that said one of the most common mood symptom people feel in the beginning is actually irritability.
That's what I would guess. Yes.
Yeah. So irritability. So mood is the number one. And then when you see number 7 in the literature, they say headache and migraine. However, to me, a headache is a symptom because a headache can come from the autonomic profile. It can come from the cervical profile. It can come from the visual profile. So a headache is also one of those other things that we want to find the driver of the headache and treat the driver, treat the root. Or you're going to be taking medication forever.
Yeah, right.
So
yeah. Okay.
The reason we can't just use symptoms to know is that there's a lot of overlapping symptoms between those profiles. Hence why we need to actually assess and can't just do it like a subjective scale.
Yes. And people can have more than one of these profiles.
Absolutely.
Most
people do. Most people do.
So yeah, so that's just good for people to be aware of as they're listening to this. So thank you. Let's talk really quick about the rest period. If someone is resting, what counts as rest in that first 24 to 48 hours? Like, is that no screens at all? Is it, can you like watch a movie, or does scrolling social media count as rest? Like what counts?
You want to stay below flaring your symptoms, really, is what it looks at. So it's a sub-symptom threshold. There's studies that have actually looked at screens, and you can use screens. You want to like pull back a bit on screens in that use, but really you're doing whatever you need to do to let your brain like heal and recover. So in this window of time, we are using increased demands in our brain just to function, and there's an inflammatory component happening and all these lovely things. And so you don't want to do anything that is going to elevate symptoms. So we typically say, like, this is if you want to nap. If you can listen to a podcast or an audiobook, listen to a podcast or an audiobook. If you don't have the oculomotor phenotype and reading doesn't flare you up at all, then feel free to read, right? It's depending on the way the concussion has impacted you is going to impact what you can do. And so, but it's in that period, it's like, be gracious to yourself. Do the things that fill your cup up and restore you, and the things that you would normally do to give you energy and give you that feeling of refreshed groundedness. And then, and avoid the things that will elevate symptoms.
Okay. Thank you. I think that's very helpful. And I know we mentioned this at the beginning or earlier, but what kind of symptom development can people generally expect? Like, what are the red flag symptoms? And I'd love for you to speak to, that things don't always come immediately. Like, it can be staggered. So, yeah.
Yeah. So we hit on like the red flags earlier, right? So a red flag is something that you're going to have an incident or an impact, and symptoms are going to usually show up pretty dang quickly. So that's things like headache, blurred vision, vomiting, worsening neck pain, decreasing levels of consciousness, seizure, any type of seizure type activity, or like that's what there's like tonic, like involuntary like contractions. We call it posturing. Those are all red flags. Any like fluid coming out of the ears or the nose, like clear fluid coming out of the ears or the nose. We don't want that either. Those are all red flags. Those are like
go to the hospital.
Those are to the hospital. But you nailed it in the sense that symptoms don't always have to show up right away. And this is where a lot of the education comes into play too. So symptoms can evolve over hours or days. And I say that because say you get a concussion, okay? Or like you have an incident where you're like, I could have a concussion. So let's say suspected concussion. It was a pretty hard hit. You had a little bit of a headache. That was the only thing you kind of had. A headache kind of made sense because of the mechanism that it could just be like your head just hurt. Or you could have a concussion. So you go home and you're like, you know what? I know I just listened to Bethany's podcast and I know that I'm going to rest for 24 to 48 hours. And so someone goes and rests and they like take it easy for a couple days and they feel good. Right. And they're just like, oh, sweet, I don't have a concussion. And then day 3 rolls around and they're like, they go to work and they go to do the thing. And now all of a sudden they are headachy and they're feeling really off and like a little bit kind of nauseous. And what I say is typically that's because for 2 days you did jack squat. And so you rested and you took care of your brain. And then day 3, you like dove into life and you exceeded your brain's capacity, both and like from a metabolic standpoint. So energy wise, being able to process, and then also from a nervous system standpoint. So then that's when symptoms start to show up. So a big piece of this, of concussion rehab is working within the metabolic and just overall capacity of our nervous system to challenge effectively when it's appropriate to then create change. So if that would be a scenario where symptoms sometimes show up a few days later because someone takes it really easy for a couple days and then they go and like dive into their full bore life and they're like, oh crap, like what is happening here?
Yes.
Versus I think I have an 11-year-old son. He's almost 11. And we went to the bike park one day. And so we have a pump track and he was riding a scooter and I'm like, his helmet, I should have known better. He's wearing a helmet and I looked over and he had his helmet back on his head. So like, I was like, dude, like pull it forward. So I was like, we need to go buy you a new helmet today. This was literally on the road. And then, so I'm sitting there, I'm reading my book, he's scooting. And then all of a sudden I hear this like wail.
No.
And I was like, oh my God. And I look up and there's a dad leading Hudson off the skate park, off this track. And like Hudson's holding his head. And I like run over. And so he had gone over a corner and like his scooter had caught a rock or something. And he went head first into this concrete corner.
No.
Curved corner, but like still head first into it. And he was like, my head hurts. And I'm like, no, your head hurts. It's like he had a massive goose ache. So I'm like sitting there. It's very different when it's your own kid.
I believe it.
And so I'm sitting there and I was like, buddy, like, do you feel dizzy? Like, do you feel like you're going to like literally asking him the red flag questions while we're on the bike park? So I'm like, are we going to the hospital or are we going home? And he was like, my head just hurts and blah, 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 blah. I know that he wasn't complaining of any of the symptoms. So I brought him home, get a cold compress on his giant goose ache on his head. And then I put him through a screen. I looked at his eye movement. I looked at all the stuff and it was all fine. And none of it flared any symptoms. And so that's an example of like, he had a pounding headache, but his head went into a concrete wall. And so I monitored him for the next 24 hours. Right. So throughout the, like every couple hours, I checked in more, but like every couple hours, I'd like retest his eye movements. I'd retest like the certain things and everything stayed stable. And the next morning he felt good. We took it easy the next day just to be safe, but he was fine. So it's like, there's also those examples where it's like, how do you not have a concussion? But our brains are freaking resilient. And not every big hit to the head also is going to equal a concussion, to be honest. Like it just doesn't, that's just the way it works.
It's so true. And I appreciate you bringing that up because that was the point I wanted to bring out here as well, that the severity, like quote unquote severity of the actual incident does not necessarily determine how severe the concussion experience is going to be. Like it's crazy. Like I have a friend who was in a car accident. She said that her car was totaled, but she didn't feel like, she didn't even hit her head, I don't think. And the other people in the car were all fine. And yet she had really major post-concussion syndrome happening afterwards. And she was so confused. She was like, I don't understand how that happened. It wasn't quote unquote that bad of a crash. And yet here she is. Right. So and yet your little guy had that major thing and is okay. It's just.
And I say too, it really is the brain you bring into the event. Right. Or I'll say like for people like that, like it's the straw that broke the camel's back. And so when you start asking people in their histories to look back, and you're looking at, well, how many subconcussive hits did you have? Right? How many, like, so I assessed Hudson after that to make sure things were still hunky dory. But there's a lot of times where something like that might happen, or you might get a concussion when like younger in life and you don't rehab it because so many people didn't, but you feel good, right? So you have this concussion history or you have this subconcussive history. Well, those are all incidences that affect how our brain potentially functions. And our brain is really amazing in that it can compensate very well and compensate to the point where you don't have symptoms. But then if you're taking a brain that's already compensating and already working a little bit harder, and then you give it another concussion or another like hit, it doesn't have to necessarily have to be as significant to be that piece that's like compensation gone. And then now you've not only lost your compensation, now you're like unveiling everything that wasn't working that was being compensated for. Right. I think we had someone come into the clinic, our emergency. So we have a really great relationship with some of the physicians in the emergency department here. So they refer a lot of people our way, which is great. And I had this young man, I say young man, he was 30, come in, younger than me. And he came in to the clinic. So it was 2 weeks later. And he was like, he's like, I'm asymptomatic. He's like, I feel fine. He's like, I felt pretty good for the last few days. His first week was really rough. He's like, but I just wanted to be better safe than sorry. And I was like, kudos to you.
Yes. Right.
0 symptoms, go to put him through my assessment, and holy dinah, did he almost fall over on my force platform when I put him in the vestibular scenario. And like had some significant vestibular findings, but everything else was working really well. So he was able to compensate. And so the beautiful thing is in that acute stage, if you're giving the brain what it needs to heal, it changes fast, which is also why I'm not someone, when you look at some of the research out there, they say, if you have symptoms, they may spontaneously recover within 10 days. Okay. So some of the recommendations out there are like you wait to see with just exercise if someone recovers within 10 to 14 days. And if not, then you refer for rehab. And I'm the viewpoint of like, why would I wait 14 days? If I can identify that there's an issue and I can give you some specific exercises to tackle it, it's not going to hurt you and it might help you. Why would I wait to see if it doesn't get better? This is our reactive healthcare system. Why would I wait to see that something doesn't get better and then help it, as opposed to the fact that I've identified it's an issue and I have tools that can help it? Why wouldn't I just do that? So for this young man, we identified that the vestibular system was an issue. Everything else was working great. We gave him exercises. You should have seen the difference in his force platform changes within 4 days. Is that spontaneous recovery? It's probably still an element, but he was already past 2 weeks. So there's probably still an element of spontaneous recovery, but I'm going to put money on the fact that his rehab exercises also helped.
Yes.
Right. And so we were able to discharge him from the clinic within 3 weeks. And each week he just kept progressing faster. But he came in with no more symptoms.
I think that's so important. And I so appreciate you bringing this up because yes, the brain is so good at compensating. It feels like it's masking it. Like you don't even know that it's like, there are so many people that I've seen who had zero idea that their vestibular system, their balance was off, or that their eyes weren't tracking and working well together. They zero idea because the brain is just amazing and does its thing.
Yeah.
I think that's really, really helpful. And I love that he came and got assessed, even though.
Me too. I gave him like huge props for that. I was like, this is amazing. Like I need everyone to be you.
Seriously, that is really, really awesome. So what is the general expected recovery time for an acute concussion? Like when should people start being concerned about post-concussion syndrome?
Okay, so first of all, it's like I don't want people to be concerned about post-concussion syndrome because if you're already feeling anxious and on day one, then you're going to increase your chance of post-concussion syndrome.
Okay.
But I think it's just awareness to know that, concussions can heal in weeks to months to years. But the people that it's typically years are people that have been mismanaged in the early stages. And there's other factors going on, usually. The best thing we can do to ideally decrease the amount of individuals that are dealing with persistent concussion is good acute care concussion. So I typically expect that if someone comes in with us with acute concussion, they're going to hang out with us for about 4 weeks. 4 to 6 is kind of and sometimes it's less and sometimes it's more. I will say generally our sport concussions actually heal the fastest. MVAs and work-related concussions tend to take longer. And the way I look at it is typically there's just other external factors involved in work and MVA related concussions, and the stress that can bring on someone will 100% impact their healing process.
Yeah.
Zero research around. Well, I'm like, there's research that show that MVAs take longer than other ones. Like that research is starting to come out. Actually, I need to find that study again. No one's looked at why. That's the why is my theory.
Yeah.
But sport related concussions typically within that like 2 to 6 weeks. And then MVAs, some MVAs are again same in that process, and then some go longer. So it just depends.
Just, for people out there who are listening, MVA is motor vehicle accident. So.
Oh yes, sorry.
In case people didn't know.
Yeah. And it's like with my team, like we support locally and then my clients fly in from all around the world, right? So the clients that fly in to work with me are individuals that have been on this journey for years. However, every single one of those clients have been pretty much mismanaged in the beginning, early stages.
Yeah. So a lot of this could be prevented by
Yes.
having good quality care at the beginning. So
Exactly.
thank you for putting that out there. So if this is an acute concussion, people who are listening, just get it checked out, like go find somebody. And do you have recommendations on how people can find somebody? Because that's a thing.
Oh, that's always the hard part, right? So a lot of I will say there's a huge education component in the acute stage. And so there is people that like I do virtual consults, right? So there is some element of that can be done virtually, but in clinic, I always, again, in your town, I always say start by word of mouth referral from someone who you know who's gone through a concussion healing process with a good provider is always the best. If you know someone, like that's always the best.
Yeah.
But if you're like starting from scratch and you don't know anybody, that's when I'm like, go to Dr. Google. But I literally just search concussion clinic in a town. I read the bios. So I'll go to a website and I'll look at services. And if concussion isn't listed as a service, then I'm almost like, hey, it's a byproduct of what this clinic offers, wouldn't be my first choice. If concussion is a service, awesome, go look at it, see if they really specify. So some clinics really only do acute sport and some do persistent. So see what it like looks in service and then go to the bios of the therapists. And look to see and look in those bios and read those bios to see like what is it actually saying they have for concussion training and look for somebody there. Now, again, there is no certification to treat concussion. Okay. So someone can do a weekend course and say they treat concussion. There's a whole bunch of different courses out there, but what you ultimately want to do is you want to go look at a bio and make sure that there's at least something concussion education wise and training wise in that bio. If that's not, then I'd be trying to find a different clinic.
Okay. That's helpful. Thank you. That'll at least give people a good place to start. So thank you. Mm-hmm. Really quick question. If a woman has gotten a concussion, what does she need to know about how her menstrual cycle can play into concussion severity?
So concussion actually, like men and women are different. And so it's looking at hormones. And so now this could be very different for someone who's on birth control. This could be very different for someone who's not, like, it's particularly the progesterone-based birth control. This may not apply. Okay. So some of the studies look at women who have their concussion in the luteal phase of their cycle, so the second half of their cycle. There can be, not necessarily is, there can be a greater drop of progesterone. It's called the progesterone withdrawal effect, which can, in some studies, show women have increased symptomology later in this phase. They have, it's a kind of I say it's a yellow flag for a potentially longer recovery if we're in the second half of that cycle. Different studies find different things, but it tends to be something that's kind of carried through. Again, birth control could change that, right? So if you're on a progesterone-based birth control, it does normalize your progesterone levels a little bit more, so you have less of a significant drop. And in a couple of the studies, that has actually removed the impact of when someone actually had. It didn't matter if it was the follicular or luteal phase, impact was the same. So. And then other studies haven't been able to reproduce that. So we're still in this, we're still learning, but I think the general consensus is, yes, it does matter. We want to pay attention to those pieces. Hormones absolutely are a factor and can be impacted after concussion. And then the other, when we're looking at like some of the stats too, there are a higher amount of women that have disruptions in their menstrual cycle following concussion than women who haven't had a concussion as well. And that can just be, it's delayed, it's late, you miss a period, those sorts of things. So hormones 1000% can be impacted after concussion. There's also this like it's a theory of this like window of progesterone, like window of vulnerability kind of piece, which is like 9 days. It's a 9-day window in a point of your cycle, and I'm blanking on when it is. But that is kind of this theory. I haven't seen a lot of studies reproduce it yet. A theory of when we are most vulnerable with either increased re-injury or risk of concussion. So when we're looking at return to play, for example, for a woman who plays a contact sport or return to play into sport, it just bodes the question of, if we know when this window is, and it's been shown in some small studies though, to be honest, small studies, like, is this a time when we want to be aware of, like, maybe we shouldn't be returning to play in that 9-day window? There's a lot of questions that still need to be asked, and there's a lot of research still being done. It's happening way faster than it ever has, but yeah.
Yeah. Okay. Thank you so much for sharing that. I think that will be really helpful for people to hear, and I appreciate your understanding all that. So thank you.
I did do, there is an episode on my podcast that talks about female hormones after concussion.
Fantastic.
So I definitely go into that stuff in more detail on that episode.
Okay, we'll find that and link to it. So thank you. And then you mentioned return to play. Is there a specific, like, what do you generally tell people? Because I know a mom listening to this is going to want to know, when can my kid go back to sport or to school or all those kinds of things? So in general, what would you tell people?
Yeah, so they should be back to full-time return to learn, ideally, before they're back to full-time sport. Is kind of the general consensus in the space. You can be doing both simultaneously, though. Okay. There is a stepwise progression on how you return to learn and how you return to sport. And this is another reason why connecting with a provider is so prevalent and so paramount, because they can guide you in that specific piece of things, right? In the return to sport world, you know, we start with light activity. We used to go like non-specific skills. We have to be cleared to push your heart rate at 75 to 80% of your heart rate max with no symptoms to be returned to non-contact practice. And then from non-contact practice, you go to contact practice. I am someone that wants to see 2 successful non-contact practices before I push you to a contact practice. And I want to see 2 successful contact practices before I push you to full return to play. I want to make sure you're confident, right? Decreased confidence is risk for injury. And so then again, we're looking at that holistic component of symptom-wise, are they good to go? Objective-wise, in terms of measures, are they good to go? Confidence-wise for themselves, are they good to go? And that piece of things. So there is very much a stepwise progression for return to play and return to school. But that is legit another reason why you need to connect with a provider, so you can get that individualized support to guide you through that process.
Yeah, beautiful. Thank you. So I know we're gonna go ahead and hop off here. I know you got other things you need to do today. So thank you so much for your time today. But is there anything else that you want to make sure, if there's a mom or a family member or somebody who just had a concussion listening, that you want to make sure that they know if we haven't covered it yet?
Okay, so if you're a mom and you have a kid who plays sports are amazing. There's certain sports my child will never play. However, please remember they're a child and they have one brain. And sometimes the parents are worse than the kids on the force and the pressure to get back on the field. And I appreciate, this is going to sound so terrible, but I appreciate that your 15-year-old son is the all-star hockey player on his team, and it's the championship game and they're going for gold. He's got one brain. Mm-hmm. Prioritize your child and their health over the sport. And my kid plays sports, and it's like, and it sucks when they got to sit on the bench for everybody.
Right?
Everyone. They have one brain, and you need to prioritize that brain. And so as a parent, do the due diligence. If they play in a contact sport, do the baseline testing. If they have a concussion, don't just wait for the symptoms to go away. Get them in with someone so you can make sure their brain's well, so they can return back to that sport playing even better than before their concussion. Mm-hmm. Like, you get to lead. As a parent, you are the one who's deciding what is risky enough and safe enough for your child. So equip them in the best way possible so that they can succeed. Mm-hmm. If you're someone who's had a concussion and you're an adult, please, 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 even if you're feeling okay, even if it's just one appointment, go connect with a provider to make sure that everything is like tickety-boo. Because I like the guy that came from Emerge, he was like, I feel good. He's like, but I just want to make sure. And he was in and out, like he was a 2.5 week person, I think, between 2 to 4 weeks, but it was like spaced out. But I think it's because I was away for a week. Like, he was not with us for very long at all. It was quick. Mm. But again, he was like, thank you. Because now he's in a better place. Should something happen again, everything's working better together, that he might not get a concussion the next time he gets bonked on the head.
Yes. Beautiful. So. Thank you. Thank you so much. And how can people hear more from you, learn from you, work with you if they want to?
Oh, there's so many ways. So I have a podcast. It's called the Concussion Nerds podcast. So it's about everything concussion. And then my Instagram handle is at natasha.wilch. I'm just going to say those two. I have a website. There's a whole bunch of things. So if you message me on Instagram, I will always message back. But there's a slew. I have programs for individuals on a healing journey. That's Concussion Mini School. So it is an amazing free resource for people where I do group calls twice a month. They have a library of like video content to help them through things. There's a private community that's free for people on a healing journey. And then, as you know, for clinicians, I have the mentorship program, Concussion Nerds. I have a foundational 4-hour workshop I teach. We have a free segment called the Clinician's Edge. That's like your weekly taste of neuro wisdom in your inbox every week. I really do believe that, and I'm trying to build an ecosystem for everyone that concussion can impact so that we have a hub of knowledge and tools and passion and education. So.
And I love it. Thank you for everything you're doing. Keep it up. It's so, so good. And
thank you. Thank you for being part of Nerds.
Yes, I love it.
Amazing.
So all right. Well, thank you for being here. I hope this will be really helpful for a lot of people. So thank you so much, Natasha.
It is my pleasure. We will see you soon.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.